Good morning. This is Dr. Philip Schneider coming to you from the Ozark Chiropractic Clinic here today. Looks like it's another rainy day out there. I don't know about you, but man, we have had enough rain to last us for a while. But fortunately, we're not in control of that, so we just have to deal with it and move on the best we can. But today, I wanted to talk a little bit about, some different symptom-based things again. Go back problems that people experience, health problems that they come to us for. And today, we're going to talk about headaches. Headaches is probably the second most common thing I see after lower back pain, and that's probably pretty uniform amongst most offices. We see a lot of people with headaches. It could be just your plain old tension headache. It could be sinus headaches. It could be migraines, vascular headaches. They're all very similar, different names, but they all come basically from the same area. What we're going to do, show you a little bit in our spine and things. Generally, when we deal with headaches, and most people's problems, no, it's right at the base of the skull. It could be in the temples, the forehead, the whole head, things. But we're going to be looking, when we do our exam and our x-rays, at the first and second vertebrae. Those are usually the culprits that are involved when they're out of alignment, pinching the nerves that will cause most people to have a headache. Whether, again, it's a sinus, because these nerves do supply the sinuses. They go back to the head, so they apply all the structures there. So that's what we're going to be looking at right there. So that's where it's very important that we have good posture and that we have good function throughout this neck, because it's going to help decrease the chance that you have headaches with too and such. Once we do our exam, we find out where we want to be. We'll do specific adjustments to that upper neck to help reduce the headaches. Things you can do at home for it are ice packs. I like ice packs right along the base of the skull, laying down. If you're a migraine sufferer, because we see a lot of patients who have those, and I know my kids and my wife have had them in the past, and so I know what they do and how bad they can be to put somebody down. And I usually tell somebody, if you feel that aura coming on, that sensation, it's coming on, if you can get in and get adjusted, a lot of times we can help decrease the severity of it. You'll get over it quicker. Oftentimes when a patient comes in with a migraine, we'll adjust them, we'll send them home and just tell them to ice it down, lay down, and go to sleep for a while. And oftentimes that helps get through it a little quicker too. And then there's other things we can look at along the lines of blood work to see if there's other connections going on that way also too. But those are some of the basic things there. Some postural habits we need to work on too. We've talked about this in the past, but we'll review, is your neck posture. Every time your head is going forward, every inch forward, you double the weight of your head. So you got to realize your head's probably 12, 15 pounds, and every time I move an inch forward like this, it goes to 24, we'll say, or 30, then it's going up to 45, and 60, etc. That's a lot of strain and weight upon the neck. So we want to make sure that we don't put as much throughout the day. So when reading things, looking at things, phones particularly, hold them up. Start making the habit so that you look side profile, that you can see, I'm holding it up. I can keep the head upright. I don't have to do this number, because that puts all the strain on your neck, and that's what most people do. So again, hold it up. If you're reading a book, things like that, hold it up a bit, so that way you just have to look down with your gaze, and you don't have to bend the head down and stuff. Simple things like that. On a computer, same thing. Make sure the screen of your terminal is up high enough that you can look straight into it. Make sure your keyboard's at a nice neutral position for your arms and elbows, so that you're hanging naturally. You don't want to be up like this, you want to be down like that. That's a lot easier there. Those are a couple things you can look at too. Doing range of motion exercises during the day if you're in an office setting, getting up and stretching the neck. If you're on the phone a lot, use a headset. Don't put it in the ear, the shoulder, that kind of thing. What I always like to do is I am right-handed, so I'll grab the phone with the left hand so I can write with the right hand there, and that way I don't have to bend the head over. So those are some little tips you can do throughout the day that way. And like I say, stretching, getting up, moving around, taking breaks from work, especially if you're in an office setting. Those are some simple things that you can try at home. Like I say, if you have questions, we deal with the headaches. Like I say, it's a common problem, and it responds very well to care. And excited to see that, because you can take people who have been suffering with headaches for years and make a difference in their life. And that is a huge difference there. So I want to thank you all for your time. I wish you guys a great day. Stay safe. And until next time, you can always check us out. You got questions, call us at 479-667-5053, or check out the website, ozarkchiropractic.com, or like us on Facebook. So until then, have a great day, and thank you very much.